Next, we're going to be looking at the 6 types of synovial joints. And we're going to be looking at the factors like shape of articular surface and the movement that the joint is capable of. With those things in consideration, we have a couple of different movements, about 6 different types for our synovial joints. Planar joints, hinge joints, pivot joints, and condylar, saddle, and ball and socket joints. So first let's look at planar joints. This is where the articular surfaces are basically flat. So think of your carpal bones or your tarsal bones, where they really just slip and glide past each other. This is going to demonstrate non-axial movement. So this is a non-axial synovial joint. So here we can see a better image of a planar joint. This is between cube-shaped bones, like those of your carpals or your intercarpal joints. Where those flat articular surfaces meet, you'll see that non-axial gliding. Then we have hinge joints, like your elbow. This only allows for uniaxial movement, so flexion and extension only. So that's motion along a single plane. For your elbow, we're seeing a cylindrical projection fitting into a trough-shaped structure. The cylindrical projection for your elbow is at the bottom of the humerus, and it fits into the trough shape of the ulna. So the elbow is a great example of a hinge joint, but also the interphalangeal joints, or the joints between the essentially bones of your fingers, what you might think of as your knuckles. Those are going to be great examples of hinge joints. So here's a better view where we can see the cylindrical structure and the trough. And they're showing the elbow as an example of uniaxial movement. Only possible movements are flexion and extension with the elbow. Then we have pivot joints, like the joint between C1 and C2, or the first and second vertebrae of your vertebral column. We can see that the dens, or the process that is on top of C2, is wrapped around with a ligament. That allows for that back and forth movement that looks like you're shaking your head no, but that's still only allowing for a little bit of movement, so it's one plane of movement, or uniaxial. Another great example is the joint between the radius and the ulna, especially the proximal joint, called the proximal radioulnar joint. You can see it on the bottom right in this image, where a ligament wraps around the head of the radius and allows for twisting, and it allows for movements like supination and pronation. So here's a better look at that radioulnar joint. And the other joint between C1 and C2 is called the atlantoaxial joint. Then you have the condyloid joint. It's sometimes called the ellipsoidal joint. And this is when both articular surfaces are oval, and we get actually biaxial movement or all angular motions from a joint like this. So you're going to have at least one oval articular surface fitting into a depression surface, but that's also going to be oval. Examples of joints that have this type of movement is the radiocarpal or wrist joints and your metacarpophalangeal joints or base knuckle joints, the joint between your metacarpal and your proximal phalangeal bone. So here's a better look at the metacarpophalangeal knuckle joint. It's highlighted here as kind of the paramount condylar joint. And again, this allows for all angular movements, so it's biaxial in plane, as that means that flexion, extension, adduction, and abduction are going to be possible. Then we have saddle joints, which are really similar to condyloid joints, but we have more elongated surfaces. We still have one fit in another, so one is going to fit into a depression, so you have concave and convex surfaces. There's really only one in the human body, which is the carpometacarpal joint of the thumb. So that's going to be the joint between the carpal bone that meets the first bone of the thumb. That's where you would find a saddle joint. All right, we can also see here that biaxial movement is possible with a saddle joint. So it allows for adduction, flexion, abduction, and extension. And then we have ball and socket joints. This is where we have a spherical head fitting into a cup-like socket. These are multi-axial joints, so they're the most freely moving synovial joints. Great examples of ball and socket joints are the shoulder and the hip joints. So here we can see the scapula meeting the head of the humerus. Even though the scapula is a very kind of shallow socket, the ball or head of the humerus does fit there, but it does have to be essentially supported by quite a few tendons and ligaments. This type of joint allows for multiaxial movement, so it's all angular and rotation. So all angular movements and rotation. Flexion, extension, adduction, abduction, and rotation. All right, next we're going to be looking at some selective synovial joints. So synovial joints are diverse. We're not going to look at every single one, but there are some that have unique structural features, abilities, weaknesses. So the 5 we want to look at are the knee, shoulder, elbow, hip, and jaw. So first let's look at the shoulder joint, or the glenohumeral joint. It's a ball and socket joint with multiaxial movement, and we are going to sacrifice some stability for a lot of free movement or diarthrotic movement in this shoulder joint. There is a very shallow cavity that the head of the humerus fits into, and so even though those two bone ends articulate together, they don't exactly fit well together. There's actually quite a thin, loose joint capsule, and we really owe it to the stability that comes from the tendons of the rotator cuff muscles to stabilize this joint. Some of the tendons, especially those from the biceps brachii, are considered super stabilizers because they're really there to secure the head of the humerus against the glenoid cavity. Now, another ball and socket joint is the hip or coxal joint. This is very stable because the socket that we find in the hip bone fits very well to the head of the femur. So we still have a good range of motion. It's a ball and socket joint, so it's going to have multiaxial movement. But because the two articular surfaces or bone ends that come together fit well, we are going to be sacrificing a little bit of movement. There's also really big tendons from big muscles and ligaments that are going to prevent exaggerated movement at the hip joint. Next, we're going to look at the knee. This is the largest and most complex joint of the body. It is multiaxial, allows for flexion, extension, and some rotation, but some of the other movements that like abduction, adduction are technically possible, but are a little bit too exaggerated to be true abduction or adduction for the knee. So we really just will stick with flexion, extension, and some rotation. There's a meniscus, or kind of a pad of elastic tissue and dense fibrous tissue and fibrocartilage at the base of the femur and above the tibia, so at the knee joint. There's also plenty of ligaments to prevent exaggerated movement, and it's really 3 joints in one. There's a joint between the femur and the patella, or your kneecap, and there is a lateral and medial joint between the femur and the tibia. Now this is a really strong joint, except when it comes to any type of horizontal blow. Some of the ligaments, like the posterior cruciate ligament and the anterior cruciate ligament, and even the collateral ligaments on the side, can easily be torn if there is a horizontal blow to the knee because of its limits when it comes to exaggerated movement. So common knee injuries usually involve one of the 3 C's. So damage to the collateral ligaments, the cruciate ligaments, or any of the cartilages or the menisci of the knee. So while it is a strong joint, it absorbs quite a lot of vertical force that gravity is putting on the body. It's very vulnerable to horizontal blows. Lateral blows or horizontal blows to an extended knee can result in tears. It can tear multiple ligaments. It can tear cartilage. And even though injuries affecting just the anterior cruciate ligament are common in runners who change direction, twisting, stretching, tearing, any of these ligaments may still need surgery for repairs. Then we also have the TMJ, or the temporomandibular joint. The TMJ is the most easily dislocated joint in the body. That's because it has a really loose joint capsule. It has ligaments to strengthen it, but few. And it's a joint between the mandibular condyle of the mandible and the mandibular fossa of the temporal bone. So the fossa is a little depression that the mandibular condyle of the mandible sits in. So if we can easily dislocate the TMJ, it's pretty common as a homeostatic imbalance. Not only is there a loose capsule, there's a shallow socket for the mandibular condyle. It usually dislocates anteriorly, and that would cause the mouth to remain open. And to realign it, a physician actually has to push the mandible back into place. So things like ear and face pain, tender muscles, popping sounds, joint stiffness, all those are common with TMJ dislocation. Grinding the teeth, or jaw trauma, or poor occlusion of the teeth, kind of clearance between the teeth, those are reasons that you might experience TMJ or further issues with this joint. But treatment for grinding the teeth does include a bite plate or a night guard, and relaxing the jaw muscles can help. And then one of the last chosen synovial joints we're going to look at is the elbow. The elbow, again, was a hinge joint that allowed for uniaxial movement, just flexion and extension only. We're looking at the elbow where we have the radius and ulna articulate with each other, and then the ulna articulate with the humerus. So this is a great example of a hinge joint, and so make sure that you're reviewing these joints that we're talking about so that you know which ones are which and which chosen ones kind of have certain features or characteristics about them that are important. If you're wondering what factors are important, go back and look at the high points for the most recent slides. All right, make sure to watch the next part of the video as well, where we continue talking about cartilage and bone injuries.